Now we call upon Dr. Sandeep Kadam, Dr. Sanket Patil and their team from D.Y. Patil Medical College, Simulation and Skills Center, Kolhapur. The session will be on regional anesthesia training under USG with VR anatomy.
.5% of healthcare expenditure of our country is lost due to patient safety issues. Good evening all. My name is Dr. Sanket Patil, Head of the Simulations and Skill Center, D.Y. Patil Medical College, Kolhapur. I congratulate ICA for their marathon run on 100th webinar. In our 20 minutes session, we will walk you through Simulation and Skill Center and our achievements. Then we will move on to our regional anesthesia workshop led by Dr. Sandeep Kadam, Professor HOD of Department of Anesthesia, D.Y. Patil Medical College.
Good evening all. Let's look at D.Y. Patil Medical College, Kolhapur Simulation and Skills Center's achievement in future planning. Simulation and Skills Center was inaugurated on October 22, 2020 in the august presence of Padma Shri Dr. D.Y. Patil Sir. It became fully operational by December 2020. The center is spread over more than 10,000 square feet area with 6 parallel workshops capabilities. Since its inception, the Simulation Center conducted more than 400 workshops and more than 4,500 participants. Football has happened in the center. To eventually push the center towards process-driven rather than people-driven, we have developed more than 40 SOPs. The backbone of any simulation center is its standard operating procedures. We can broadly place them into the following 15 categories. In the last 21 months, we have trained 61 faculties of D.Y. Patil Medical College in simulation utilization. Among them, 28 are simulation-based education specialists and 33 are individual simulator specialists. This creates more opportunities to maximize simulation centers' utilization. Together with these trained faculties, we run 26 different types of workshops and we keep developing more. Simulation center management is moving towards self-sustainable center in coming few years, with the intention of targeting the regional healthcare institutes and hospitals and catering to their training needs. We also have the intention to serve the community by training them in first aid and CPR. With the clear instructions from the President, Dr. Sanjay Patil Sir, we are going to expand our lab every year to keep up the lab to the latest simulation technology. Now let's take a walk through our simulation center.
Good evening, everybody. I myself, Dr. Sandeep Kadam, Professor, HOD Department of Anesthesia, D.Y. Patil Medical College, Kolhapur.
And myself, Dr. Rashmi Vijay Zawan, Professor, Department of Anesthesia, D.Y. Patil Medical College, Kolhapur.
You all know we anesthesiologists live on the edge of a cliff, where the clinical situations can go on either way at any moment. To handle these situations, we need to take appropriate decisions and communicate with our peers to handle that situation properly. Well, simulation offers a innovative and reproducible training experience. We do conduct various high fidelity case scenarios in our sim lab. You have already seen what high-end mannequins we have in our sim lab. As far as teaching regional anesthesia is concerned, we have following things in our lab. Okay, we have a dedicated ultrasound machine to teach our students the ultrasound guided regional techniques over here. So we have a linear probe, a curvilinear probe with us to teach various techniques in this lab. This sim lab has a blue phantom to teach the needling techniques. We have a part task trainer to teach supraclavicular nerve block as well as putting in center lines. We have a pediatric task trainer as well. There are various part task trainers for various departments such as gynecology. We have a part task trainer for teaching tab block. This is dedicated for renal biopsy. And then these blue phantoms are for putting IV lines, putting arterial lines. And this part task trainer is meant for teaching spinal anesthesia and epidural anesthesia with help of ultrasound machine as well. Well, anatomy forms an important part of regional anesthesia technique. If you know anatomy properly, then regional anesthesia technique teaching as well as learning becomes easy. To teach anatomy, we do have a fantastic model over here. This is Anatomage, wherein we can teach anatomy in a three-dimensional way, which we have learned in the actual anatomy, in the anatomical dissection halls, wherein we actually dissected the bodies. But here it's a very fun learning on this Anatomage, wherein we can have a three-dimensional picture. In this three-dimensional Anatomage model, we can actually dissect the parts as if we are dissecting the parts and show the nerves how they exist in this and the relation with the muscles, with the blood vessels and with each other. So you can see over here, part by part we are removing the muscles and we are reaching the brachial plexus, which can be seen here nicely. Actually, here we can also show how our needle position will be while giving blocks over here. So you can select from the needle over here, the various needles we can select. We can select the syringe and we can show how we give the block and where the supraclavicular block is given. To overcome the problems which we have mentioned in our traditional way of learning, here we teach in a simulation-based environment, wherein the training is effective education tool for acquiring knowledge and skills, gaining hands-on experience through repetitive practice without harming the patient. So here, to gain proficiency in ultrasound-guided regional anesthesia, it requires the practitioner to acquire cognitive as well as technical skills. Many publications do conclude that simulation practice has shown to enhance proficiency in ultrasound-guided regional anesthesia. You all know ultrasound has come in a big way in anesthesia practice, and so ultrasound-guided regional anesthesia technique has to be taught to our students in a simulated environment to gain adequate proficiency and confidence to actually perform these blocks on a live patient. The traditional apprenticeship model or C1 do-one method of learning, which we learned when we were students, was like this. The teacher used to show how the block was given, she used to show the anatomy, and she used to perform, or he used to perform, the actual blocks. And then the students used to perform similar kind of blocks on a live patient. But this kind of model can result in inconsistent learning and can compromise the patient's safety as well. And also, the time pressure during the clinical care can limit teaching opportunities, and actually the residents may not feel confident in performing regional anesthesia blocks. For successful performance of ultrasound guided regional anesthesia procedure, a triad of 3 distinct but interrelated skills are required: image acquisition, anatomical interpretation, and hand-eye coordination. The clinician should successfully acquire an image and then correctly interpret the sonoanatomy. Next, the needle must be visualized and guided to the desired target. This dynamic process requires practice, practice, and practice. So, actual teaching of regional anesthesia in simulation setup, we begin with the theoretical part with PPT presentation and tracing more on anatomical part, where we teach the actual anatomy of the brachial plexus, maybe then it's which type of blocks we give for the various regions, then the anatomical part which we have shown in the slide form, and then the sonoanatomy. So actual practicing of needling is done on Blue Phantom, wherein ultrasound image is seen, and we target the you can actually see the needle being targeting the vessel over there. Other thing is, on this mannequin we can show, you can come over here, you can show the actual targeting of supraocular nerve block on this part task trainer. Now let's take feedback from our students.
Hello, this is Abhishek Verma, resident of Anesthesia, DY Patil Medical College and Hospital, Kolhapur. Residents like me we are remarkably benefited by this program. We feel thus this program shortens the learning curve of the techniques. It allows us to learn at our own individual pace, and henceforth there is no time pressure. It helps us to be well versed in non-technical skills such as communication skills, situation awareness, and creation of low stress environment, as it is more important for us because anxiety can affect our performance.
Thank you for this presentation. There will be a lot of residents in anesthesia and practicing anesthesiologists benefiting from your presentation. Kindly accept the e-certificate of appreciation to your team from the Indian College of Anesthesiologists.
You are watching special featured presentations on the occasion of 100th ICA webinar.